My dear followers, hope to be well. I want to emphasize and mention to this point, hip joint is a very important joint in our body. It's a ball and socket joint and involved in every kind of movement in our body, sitting, standing, and every point of movements. I want to emphasize also at the present two different cases. One 73 years old patient with severe kind of hip destruction underwent total replacement in the other center 10 years ago, and after 5 or 6 years due to infection the prosthesis removed and the spacer implantation didn't used for her. And now after 3 or 4 years of losing her hip joint, she presented to us for solving the problem. And as you see here, at first we closed the symphysis pubis, and after some months we went to doing total replacement. It's a complex total replacement. As you see here, we put cages, triple arch system due to muscle weakness and muscle destruction, and also lumbar system due to necessity of calcar replacement, prosthesis kind like, and like this as you see here. And it is the final result. We are very satisfied from this kind of operation, but it's a very complex operation, and I hope to be able the patient to have some rehabilitation from tomorrow and return back to normal lifestyle after 3 or some months. And the next patient is 73 years old patient with severe low back pain history and neglected hip problem. He underwent multiple treatments of low back, injection, physiotherapy, but the most important point, and it's very important for you to know in your patients, in your families, if the patient has some hip problem, it is a shortness of lower extremity. It is the most important point. And now, as you see here for this patient, it is severe shortness of lower extremity. He presented to us for solving the problem, and after doing X-ray, we planned for total replacement. And now after total replacement, the shortness of lower extremity and all the hip problems and destruction of hip joint resolved by hip replacement, and the patient is able to walk from tomorrow. It is amazing for the patient that normal lifestyle will return from tomorrow. And thank you very much for your attention. I want only to emphasize to this point, be careful about your hip joint. Thank you.